Hello friends, we are at step 3 now. By this time, health facility team have decided what they want to improve, formed a team, identified some of the causes for poor care and development, some measures to indicate how our project is progressing. After diagnosing the problem, the team now must take actions to correct it. This involves developing ideas about what to change to fix the problem. We will also discuss how to test these ideas in our own workplace to learn if they work and to adapt them to your setting. In this set of presentation, you will learn how to develop ideas about what to change to reach your aim and how to test these changes using Plan, Do, Study, Act, that is PDSA cycles. Therefore, to start a PDSA, the team has to identify some changes, in other words ideas that they think will work in their situation. The team members will come up with different ideas. Review the possible change ideas if these are important for patient care and are likely to be effective and feasible at their workplace. Test the ideas to learn if these work and to adapt them for your setting as required. When you are developing and reviewing the possible changes, it is good for the team to discuss, based on what we learn from our analysis, what changes should we make, why and how will this change solve our problem we identified in our analysis, and what result do we expect to see in the process and outcome measures, that means the indicators. There are several types of changes that you can make in your health facility. Some of the main categories include improving knowledge or skill of the healthcare provider, that is by training, eliminate waste by stopping unnecessary treatment or steps of care, that is stop doing harmful or useless practices. Improve the patient relationship and communication, that is by feedback, her experience of the care received or by listening to what patients want. Manage variations in the existing treatment and care practices, that is by following more standard and practicable process of care. Examples of changes include improving knowledge or skill of healthcare worker, like teach the importance of keeping babies warm and how to do skin to skin contact and other treatments. Eliminate waste by moving equipment so that it is close at hand to reduce the time to access it when required patient care, like pre-filled and level syringes of 10 units of oxytocin for active management of third stage of labor. Improve the patient relationship and communication by pre-delivery counseling for women to find out what care they would like during delivery or counseling her for PPICD during antenatal period. Manage variation. Examples are like establish the practice of triage on new admission to the labor room, so you can prioritize care and decide how to allocate resources or adopt standard treatment protocol for common maternal and newborn conditions. The following steps are of utmost importance when you are planning for a change. All these steps are to be answered and documented before the action starts. What needs to be done? Who will do it? Who will measure indicators? When will it be started? When, that means at what interval will result be reviewed? The rationale of testing things initially at a small scale is that it allows you to know if it succeeds and give you the confidence to practice at large scale and adopt more innovative changes in future. As much as possible, it is good to test each change idea individually. It is also important to highlight that some of your change ideas will not work. That is good. Testing on a small scale means that they will not do any harm or they are an opportunity for learning. It is good to test the changes or ideas in different working conditions to learn if the change always works. For example, testing on weekends or night time will let you know if changes will work when there are fewer staff. It is rare that any change idea will work perfectly at the first time. It will usually need some adjustment to work in your setting. So, test in a small scale. The PDSA cycle is very useful for this. PDSA stands for plan, do, study and act. These are steps to take when testing a new idea. Plan. You decide how the change idea will be implemented. Do. Carry out the change. Study. The team reviews whether the desired change has been fully implemented, what they learned from the test, whether it was a success or a failure based on the collected data. And act. The team decides what to do next depending on the experience and result of implementing the change idea. It is important to emphasize that a team can do small scale PDSA cycles very quickly. For example, when someone is cooking and they decide to add salt and see if it tastes better, they are doing a PDSA. Team can do short PDSA cycles as well to learn how new ideas are working and to adapt them. So, in the planning step, the team decides who will test the change or the new idea, what they will do, when they will do it, what you want to learn from the test. After testing comes the study of the result. The team reviews what they learned from the test, whether it is feasible in our work setting, whether it was successful in addressing the problem as hypothesized by the team. Now comes the act. Act after studying the result of implementation, the team will decide to adopt, adapt or abandon. Adapt the change means if it has not fully succeeded, make some modifications and implement again. Adopt the change means if it works perfectly, make sure everyone in the health facility uses this change. Abandon the change means if it does not work at all or make things worse, stop doing this. PDSA cycles are also used to move towards making the change at a relatively larger scale and sustainable. When you are in the trial phase or the pilot phase, the tests should be small, short and frequent. As you learn what works, you can move towards the implementation phase with larger numbers. When you are trying to sustain a change, that means trying to implement it, PDSA cycles are larger because you want to see if it works across a wide range of people and situations, for example, in all units of the hospital. Implementing the change that lead to improvement. We have to take care that the successful changes are adopted by other units in the health facility or hospital, since it is very likely to succeed, hence improving care across the facility. At the same time, it should be embedded in the system so that it is adopted as a permanent practice. Remember that you are making changes to improve quality of care. Changes will lead to improved care if there are the right changes. A wrong diagnosis of the problem when you are analyzed it will pick up a wrong change and it will not work. If they are put into action, if the team members including the frontline workers do not want to make the changes or do not know how to implement and practice the changes, then the change will not work. It is crucial to involve the frontline workers at all steps so that they help pick the right changes and then they can implement the change and sustain the practice if the change was successful. And third one, they are adapted to the local context. Ideas from other settings may be good in theory, but need to be tested to make sure that they work properly in the local setting and may need to be adapted. PDSA cycles are invaluable for making sure that you select the right change, that the change is put into action after right planning, the effect of the change is studied, changes that are successful are sustained and scaled up, and those that fell are discarded. There may be multiple ramps of changes towards a single aim. Take this example. Here, the aim was to reduce severe hypothermia in newborn babies by 50% in 3 months. There were 3 RAMs. The number 1, maintain baby's temperature. Number 2, staff education and involvement. And number 3, maintain ambient temperature. Multiple PDSA cycles were done to achieve the aim. So, I repeat once again, it is rare to succeed with doing one PDSA cycle per change idea. Therefore, to test one change at one time and do multiple PDSA. Thank you.